I'm Brian Savoy. I'm the Senior Vice President, Education and International Programs with RAPS.
I'm Steve Mondernach, and I'm the Executive Director for the Association of Food and Drug Officials. The Healthcare Products Initiatives brings together the communities that previously worked with Xavier Health in a little bit of a new package. So bringing together the best of the strengths of both AFDO and RAPS, really seeking to expand the communities, broaden them a bit, and continue them into the future, really looking toward that innovation. What are the next things coming in these industries, these communities that we need to be working together, collaborating, and doing the next step of development, essentially.
Xavier Health put together this really unique and valuable deep collaboration between industry and health authorities. It was truly unique, and we're really pleased to be able to continue the work and the outputs that came out of those efforts. It's exciting to see where we're going to be able to take these over the next year and the next several years.
The things we see is amongst the strategic committees is some overlap. So we see people from various different disciplines kind of part of each of the committees. So for example, in AI, you see a few folks from the pharmaceutical, you see a few folks from medical devices, a few folks from combo products, all part of that event workspace and working together. But we see that in other areas. So you just kind of have this unique collaboration amongst all these different areas that may not necessarily touch all the time in a normal space, but they do, because they do have overlapping interests and concerns, and really their technologies, what is hitting one today will probably hit the next one in another year. Those sort of things, they really leverage the best from all of the communities.
So you have this diverse environment, okay, where, regulations, impacts, technologies, new quality systems are coming out and they need to be adapted. And the way that those systems work together and impact the jobs to be done within healthcare products companies is constantly evolving. Questions come up, and working in partnership with regulators across each of those event types, you were able to generate positive change for all of the stakeholders.
So this is really an opportunity to learn from your colleagues. It's not like other events. Other events you get lectured at, or you may have a little bit of interaction. This is highly interactive events, and when you're doing that, you're learning from your colleagues. You're building essentially your network of people you can consult when you have a problem that's unique, and say, hey, I know this person, I'm going to give them a call and see what they would do here. It's very different, and it's highly interactive throughout the whole event, and really worked on solving, what's next, what are you thinking, how do we do this better, type things across the industry, which is not always the norm at other events.
Yeah, I think from my standpoint, what you see why somebody wants to come to this event is because at many conferences, it's about listening to that sage on the stage and, getting a great download of great information, and that has its place. But at these events, at the collaborative events, just about anybody who is a participant could go onto stage and present something just as valuable that they're hearing from a facilitator as what the facilitator is presenting. And it's that deep collaboration that makes this unique and valuable and is not replicated anywhere else in this market. Companies that partner with us get a unique access to a community. It's kind of like walking into the living room and finding, here are these people in this comfortable environment who can work together to solve problems. You have a seat at the table by partnering with us. You're working hand in hand with the regulators, with the health authorities, with members of industry to solve these problems. And you're there when it's happening and where